In November, the Centers for Disease Control and Prevention released data showing an increase in babies being born with syphilis, impacting 3,700 infants in 2022. KIMT News 3's Maureen Dudley spoke with Olmsted Medical Center on how it's affecting us locally and what expecting mothers can do to prevent spreading it to their babies. Maureen?
Nick, according to the Minnesota Department of Health, in 2022 there were 20 cases of congenital syphilis in the state. Congenital syphilis can happen when syphilis is passed on to an unborn baby from the infected parent. Olmsted Medical Center says when expectant mothers come into their appointments, it follows the MDH guidelines of checking its patients for sexually transmitted infections when they come for their initial appointment and at 28 weeks of pregnancy. For patients who test positive for syphilis while pregnant, OMC says it's treatable with penicillin. If it's caught at birth, the medical center will work with the parents on testing options as well as the potential risks of having a baby with congenital syphilis. Dr. Melissa Richards with OMC says patients should feel comfortable asking their doctor for STI testing.
There's no shame. There's no shame. There should be no shame. But we want to get rid of that shame so then we can identify and treat and help avoid things like congenital syphilis.
According to Dr. Richards, you don't even have to visit a doctor's office to get the STI testing. They can have it ordered for you over the phone. Live in Rochester, Maureen Dudley, KIMT News 3.
Thank you, Maureen. Olmsted Medical Center is also working on continuing a health series called Pelvis Party to help reduce the stigma around reproductive health. Some of the educational videos are already available on OMC's website.